Our topic today is a key lecture, an introductory lecture. Yes, we shall speak about a few terms. What do you mean by arthralgia? Arthralgia, it means a non-specific aches and pains in a joint or joints. The same about myalgia. By myalgia we mean aches and pains in the muscles. Another term is arthritis. Arthritis is equal to arthropathy. So if you hear an arthropathy, it is the same like arthritis. By arthritis we mean that there is a pain, a swelling, tenderness in that joint or joints. So we have pain, swelling, and tenderness, and restriction of movement of that involved joint. Now, arthritis might be polyarticular, or might be polyarticular, or might be monoarticular. What do we mean by polyarticular arthritis? It is called polyarthritis. By polyarthritis we mean that we have an arthritis in 5 joints or more. By monoarthritis we mean that we have an arthritis in a single one joint arthritis. By oligoarthritis, or also called polyarthritis or polyarticular arthritis, it means that we have arthritis in 2 up to 4 joints. So it is 2, 3, 4 joints arthritis is called polyarthritis or oligoarthritis or polyarticular arthritis. These simple terms are important as many diseases follow a specific pattern of involvement. Now, a few words on monoarthritis. Monoarthritis, we mean single joint arthritis. Monoarthritis might be an acute monoarthritis, or it might be chronic monoarthritis. By chronic monoarthritis, we mean that we have an arthritis in a single joint for more than 2 months. By acute monoarthritis, acute monoarthritis, differential diagnosis. Actually, acute monoarthritis is considered to be an emergency in rheumatology because the differential diagnosis of acute monoarthritis involve the following causes. 1. Septic, between bracket, infectious arthritis. So septic arthritis is an emergency. Definitely it is an emergency because septic arthritis is the most destructive disease of the joint. The second cause of acute monoarthritis is a crystals monoarthritis. Might be crystals monoarthritis, might be due to gout and naqras, or pseudo gout, or others. By others we mean small microcrystals. Now, the third cause of acute monoarthritis is traumatic. traumatic arthritis due to trauma. The other cause, the fourth cause of acute monoarthritis is inflammatory acute monoarthritis. Actually, it might be seen in 15% of rheumatoid arthritis. Most of the rheumatoid arthritis is presented as a polyarthritis, but it might be presented as acute monoarthritis. And the other is a seronegative arthritis or seronegative spondyloarthropathies. For example, reactive arthritis, Reiter syndrome, might be presented as a single joint arthritis, especially of the knee joint. Just as we have said, acute monoarthritis is an emergency. Now, a few words on EMS. What do we mean by EMS? EMS is early morning stiffness. Early morning stiffness is one of the parameters of evaluating and of following up the rheumatological patients. Each normal person has an early morning stiffness, but this morning stiffness is just only for a few minutes, and usually it is mild, not severe. So early morning stiffness might be normal if it is for only a few minutes and it is mild. Early morning stiffness might be seen in inflammatory joint diseases and in non-inflammatory joint disease. The difference between them is as the follows. In inflammatory joint diseases, the EMS is more than 30 minutes, half an hour, and it is usually more than 1 hour, more than 60 minutes, and it is severe. For example, in rheumatoid arthritis, in ankylosing spondylitis, in gouty arthritis, in SLE, in reactive arthritis like Reiter syndrome. Okay, here we have an early morning stiffness of more than half an hour, usually it is more than 1 hour, and it is severe. Actually, the duration and the severity is also used for following up that inflammatory joint diseases. For example, after treatment, if the EMS drop down, so it will be a parameter of improvement. Now, in non-inflammatory joint diseases, the EMS, the early morning stiffness, is less than 30 minutes. For example, in osteoarthritis, the EMS is less than 30 minutes. So, although it is called osteoarthritis, but we have the pervixitis, although that it is not an inflammatory. It is a non-inflammatory rheumatological disease or condition. And the EMS is less than 30 minutes. The same about localized pain syndromes. Localized pain syndromes involve something of about 62 well categorized conditions. And all these All these are non-inflammatory rheumatological conditions. Also in fibromyalgia. Fibromyalgia is a non-inflammatory rheumatological conditions. And in these conditions, the EMS is less than 30 minutes. Now, another topic is the patterns of joint involvement. Patterns of joint involvement. Patterns of joint involvement is characteristic in different rheumatological conditions. We have three patterns of joint involvement. One, we have an additive polyarthritis. The second is a migratory polyarthritis. And the third is the palindromic, between bracket, episodic arthritis. Now we shall speak about each one. What do we mean by additive polyarthritis? In additive polyarthritis, we have an addition of a new joint involvement, a new joint swelling, tender, and the previous involved joints are still involved. So we have an involved polyarthritis, we have many joints arthritis, and here we have an addition of a new joints arthritis. Such a pattern is typically seen in rheumatoid arthritis, in SLE, in seronegative spondyloarthropathies. The second pattern is migratory polyarthritis. Here in migratory polyarthritis, the involved joints remits. We have a remission in the already involved joints, while another joints are involved. So we have an involvement of a new joints, while the previously involved joints will remit, will dissolve. Such a pattern is typically seen in rheumatic fever and in GC arthritis, gonococcal arthritis, especially if it was associated with tenosynovitis. Migratory arthritis and tenosynovitis is one of the characteristic features of gonococcal arthritis, GC arthritis. While the third pattern is the palindromic arthritis. Here we have repeated attacks of joint swelling which remits completely, leaving no residual damage. Example, palindromic rheumatism. Many times palindromic arthritis later on may pass to a stage of rheumatoid arthritis. The other disease is familial Mediterranean fever. In familial Mediterranean fever, the presentation is that of palindromic or episodic arthritis. Now, a few words on the distributions of joints involvement. Distributions of joint involvement is a characteristic in rheumatic diseases. We shall speak about two examples. The distribution of joints involvement in rheumatoid arthritis and in that of ankylosing spondylitis. The distribution of joints involvement in rheumatoid arthritis and compare them to that of ankylosing spondylitis. In rheumatoid arthritis, in the well-established disease, it is a polyarthritis of the small joints of the hands and feet and peripheral joints arthritis. The axial joints is not involved. So the joints involved in rheumatoid arthritis are the MCP, metacarpophalangeal joints of the hands, the PIP, the proximal joints, the proximal interphalangeal joints of the hands, of the fingers of the hands, the wrists, the carpometacarpal joints, the elbows, the shoulders, the cervical spine, hips, knees, and small joints of the feet. The distal interphalangeal joints of the fingers are not involved. One of the characteristic features of rheumatoid arthritis that the distal interphalangeal joints of the hands, of the fingers of the hands is not involved. Also, it is sparing the sacroiliac joints and thoracolumbar spine joints. So, the sacroiliac joint is not involved. The dorsolumbar spine also is not involved. Also, rheumatoid involves the TM joint, the temporomandibular joint. Also, it is involved. While in ankylosing spondylitis is mainly a disease of the axial joints. So it started in the sacroiliac joints and it ascends upwards, involving the lumbo-dorso-cervical spine, and also it involves the shoulders, hips, and knees. So the distribution of joints involvement of the ankylosing spondylitis is on axial joints involvement. Now, as just we have said, the distal interphalangeal joints is not involved in rheumatoid arthritis, but the distal interphalangeal joints are involved in the following other conditions. Distal interphalangeal arthritis is seen in osteoarthritis. It is called Heberdine's nose. Also it is involved in psoriatic arthritis. Also it is involved in gouty arthritis, gout. Also it is involved in septic arthritis, and the other cause is traumatic, due to trauma. Now, a few words on consistency of joint swelling. Any joint swelling might be hard swelling, hard bony swelling, or it might be a soft tissue swelling, or it might be a fluid swelling, or it might be a mix. Hard bony swelling, the first one, is usually seen in osteoarthritis, for example, OA of the knee and Heberdine's nose in the distal interphalangeal joints, and Bocard's nose in the proximal interphalangeal joints in osteoarthritis. while the soft tissue swelling, it is due to soft tissue swelling and usually due to synovitis hypertrophy, typically seen in rheumatoid arthritis, due to synovitis and soft tissue synovitis swelling. It is felt as a bulgy, duffy swelling, soft tissue swelling. The other cause of joint swelling is fluid. Fluid is felt as fluctuant. The fluid joint swelling might be synovial joint fluid swelling, or it might be hemoarthrosis, blood swelling inside the joint, B, and C, it might be purulent, purulent fluid in that joint. The fourth type is the mixed. Here we might have a hard, bony swelling with the fluid, or a soft tissue swelling with fluid. Now, a few words on differentiation between mechanical and inflammatory rheumatological conditions. The typical example is the differentiation between a mechanical back pain and inflammatory back pain. An inflammatory back pain, for example, an ankylosing spondylitis, we have a prolongation of the EMS. EMS as the early morning stiffness is for 1 hour or for many hours, and it is severe. While in mechanical conditions, mechanical back pain, the EMS is less than 30 minutes. Now, the effect of rest on the mechanical back pain. The mechanical back pain is usually decreased or relieved by rest, while in inflammatory back pain, for example, ankylosing spondylitis, the pain increases after rest, and the stiffness also increases after rest, but it is relieved during the daytime, during the working, during the movement. This is opposite to the mechanical back pain. A few words on synovial fluid. Inside the synovial joints, we have synovial fluid. The synovial fluid inside the big joint, for example, the knee joint, the biggest joint in the body, is less than 3 or 3.5 milliliter or below. The synovial fluid is grouped into 4 types of synovial fluid. We have a normal synovial fluid. We have a non-inflammatory synovial fluid. We have an inflammatory synovial fluid. And we have a septic synovial fluid. The normal synovial fluid is usually colorless or straw color. It is clear, the viscosity is high, the white BC inside it is less than 200 per cubic millimeter. And the polymorphonuclear leukocyte is less than 25%. While in non-inflammatory conditions, by non-inflammatory conditions, example for it is osteoarthritis, osteoarthrosis. The number of white BCs is 200 up to 2000 per cubic millimeter, and the polymorphonuclear leukocyte is less than 25%. An inflammatory synovial fluid, the third group of synovial fluid, it is white to yellow in color. It is transopaque. The viscosity is low. The number of white BC is 3,000 up to 75,000. An inflammatory synovial fluid, we mean, example, rheumatoid arthritis, reactive arthritis as Reiter's syndrome, and gout. Gout is also of the inflammatory joint diseases. The number of white BC, as just we have said, 3,000 to 75,000, and the polymorphonuclear leukocyte is more than 50%. Now, the fourth type is the septic, the infectious synovial fluid. Here we have a septic arthritis. As just we have said, septic arthritis is an emergency. It is an emergency. Here the color of the fluid is variable. It is turbid, opaque turbid, and the number of white BCs is more than 90,000. And the number of polymorphonuclear leukocytes is more than 90%. And all these, we have the crystals is seen in conditions of crystals arthropathies. In crystals arthropathy, we may discover crystals.